All right, Are You OK Day is an important chance for us to all open up and discuss mental health freely, but this year seems to take on extra meaning. Australia has been hit with a pandemic that has thrown us into lockdown, taken lives and cost jobs. Lifeline calls have reached a record high in the organisation's 57-year history. And as tough as it is, mental health is now more than ever something we need to talk about. I caught up earlier with the co-director of Health and Policy at the Brain and Mind Centre, Professor Ian Hickie. Well, Professor Ian Hickie, thank you so much for joining us on Sky News Across Australia tonight. How important is today when it comes to battling the mental health demons that are out there at the moment?
It's so important that we have these national discussions. So Are You OK Day in Australia and suicide prevention worldwide. Incredibly important days for a really hard topic, but one we need to talk about.
Professor Hickie, we now know that Lifeline has received record number of calls in recent days and weeks, obviously off the back of some of the COVID restrictions and dramas that are going on at the moment. That says something about the mood of the country right now?
It certainly does. We know the country's struggling. The COVID situation has been a massive disruption to all of us, economically, socially, kids in schools, and the way we just live our lives. So it's been a challenge. Up to this point, people have tried to make the best of it, but the economic reality, the social reality, the virus is still out there. We don't have a vaccine. Our lives are still very disrupted.
And Professor Hickie, you're worried that we could be in for a so-called third wave of deaths in this country, but of course not specifically related to the pandemic or the coronavirus itself, but of course suicides and the mental health breakdowns that are attached to, being in this situation with job losses, business losses, and of course a loss of freedom.
Look, this is so important, Peter. So we can engage in the same kind of statistical modelling for suicides and mental health injuries as we do for viral infections that result in pneumonia and the loss of life from physical health causes. And as you quite rightly point out, they're driven by job loss, educational disruption, social breakdown, domestic violence, drug and alcohol use that all increase in this situation. So it's a terrible, perfect storm of risk factors for poor mental health, for psychological injury, and for, sadly, suicidal behaviour. So this is a really tough time. But just like we've had to take on the health challenge associated with the virus physically, we now need to take it on in terms of the mental health impacts.
Professor Hickie, we've got a federal budget coming up next month and, of course, many challenges for Josh Frydenberg. But I would imagine that they will be cognizant of the mental health challenges facing Australia over the next 12 months, 24 months. Are you hopeful that the federal government will recognise that this is such a big issue that extra funding is required?
Yes, fundamentally, Peter, because the Prime Minister, Scott Morrison, when he was elected, said that youth suicide prevention was one of his highest priorities pre-COVID. And he has appointed a suicide advisor, prevention advisor in Christine Morgan. He's appointed a new Deputy Chief Medical Officer in Dr Ruth Vine. So there's real seriousness there, and there's no doubt that the Health Minister, Greg Hunt, has been very serious during his time in the job. But now's the time when real actions have got to match the words, and they've got to match it in this October budget. We cannot afford to put off to next year just because it's hard, just because it's complex. So the challenge in this very difficult environment is for the Prime Minister and the Treasurer and the Health Minister to go, okay, you know what, this time around, serious money, serious reform. There's a Productivity Commission report on what to do sitting on the Treasurer's desk right now. So this time, we need to get on with it. Unlike other areas like aged care and other areas which are still the subject of inquiry, we don't need any more inquiries in mental health. We need serious action led by the Prime Minister. I must say in partnership with the states, because there's a lot of state issues here along with federal issues. But now, this year, 2020, is the time for action to save lives in 2021 and 2022.
Ian, what do you say to people, particularly those in Victoria right now, who are in the grip of a COVID lockdown and, they're only allowed out for 1 hour a day? This is a time when a lot of people, literally, struggle with their mental health. What are the best ways to combat that type of sort of mood at the moment?
Well, there's two issues, Peter. One is the issue in Victoria, where the lockdown again, the sense that this is ongoing, it's not clear when it'll end, it's not clear how it comes out, is creating additional burden. But it's important to say the impacts of job loss, shutdown of industries, tourism, hospitality, right across the aviation sector, education, are right across the country. And some of those areas, like rural areas of New South Wales and Queensland, which are already affected by bushfires and drought beforehand, there's a lot of regional areas already really struggling. Now in Victoria, there is an issue of actually acting together and quickly and effectively. My own view is the sooner the virus is under the control, best we can, best that is achievable, then we all get back to more normal lives. But there are many, many sets of issues. And I think one of the issues is what we do as a community. And I think, unfortunately, at the moment, we seem to have more squabbling breaking out between our political leaders than in cooperation. But as a community, how we act together to support each other. So the Are You OK Day is checking out each other, but also the responsibility of the health system is, if you're not okay, that we will be there to help. So a lot of people have asked, are you okay today? What if the answer is, I'm not okay? Actually, I need help. And we've got to make sure the health system is there to actually do that. And we've seen the Prime Minister get involved in Victoria to put $30 million more into Victorian services alongside $60 million from the Victorian government. So when governments work together, we can then provide the health safety net on top of the community support.
And Ian, just before we go, a lot of contention about borders and lockdowns and exemptions and whether in fact borders should be reopened. Certainly in Queensland, it's an absolutely massive issue, and it will actually turn out to be the key issue leading into the October 31 election. Would you suggest to politicians, respectfully, that they should open borders? Well,
Peter, I'm on the record of saying the state-based approach that we've had in the past isn't really working. We need a much more nuanced region-based approach. If you're in any of those border areas, I've got patients who are living in Ballina and Byron Bay who need to go to Brisbane for healthcare. There are other issues that are running here. We need a much more nuanced approach than just every premier for themselves in this particular thing. And then exemptions. The Rugby League can go to Queensland, but other people can't. Or the AFL can go to Queensland, but other people can't. These kind of ideas don't make much common sense. So the regionality issue, sorting out how Australia's regions function, and this will be an ongoing issue with the virus. So where we don't have major issues, we get on with our lives. When we do need to react and be more cautious, that we do that on a regional basis and do it smart. I'm afraid our 1901 federation isn't really working at this point.
Professor Ian Hickie, I know you've been very busy today. I really appreciate your time tonight on Sky News Across Australia.
Thank you so much for your time and interest. And it's really important Australians stick with this. And we hope the Prime Minister does take the right action in the October budget.